the ER. I'm gonna show this around, and you tell me what's wrong with this picture, and then we'll start with cardiac. First thing you do is assess your patient. Always, 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 vitals on your patient. Where are your patients? Where's your lead? Yeah. You got a rhythm. You got a ghost. So
Perfect.
that's in the ER. It's an actual one in the ER. Yeah, yeah, it's room 3. But
That tells you a lot.
is there a ghost in the ER?
Possibly.
So I took a picture of that because
Where was this at?
in here, in room 3. Here.
Douglas?
Yeah.
I don't know who's touching it.
No. So it's actually patient, because there's no patient there, but you have a bit of.
So that's fine for you now.
Yeah.
Everything's going.
Thank you. All right, first thing I teach everybody,
You think that was like, was that like really like there was a patient?
there was not a patient. There was nobody in the room. The room was dark. I cleaned it, hung up their strips.
Okay,
and-
so it's not like it was supposed to be hooked up to
No.
somebody,
Nope, there was nobody there.
but there was.
Everything. So check your patient. Always, always check your patient. Okay, so regular heart rate on a person average is 60 to 100 beats a minute. Average, if you're not tachycardic or. So if your heart beats 80 times a minute times 60 minutes, how many beats in 1 hour is that? Your heart beats all by itself. Doesn't have to be taught to beat. It just does it.
From 48.
Yep. Okay, so what about in 1 day then?
14, 40, more an hour in 1 day.
In 1 day. So if you do 48 an hour, 4,800 an hour, how many beats in a day?
I'm about there. I'm about there.
Okay.
I'm about 96. 104,000.
115,000 beats a minute, a day,
Yep.
by itself, without you guys having to tell it to do it. It's amazing. I love cardiology. That's why, because the heart has its own system, has its own thing. As long as you've got blood, you've got oxygen, you've got the right nutrients, good catch. It will do its own thing. The heart is an amazing, amazing organ.
That's because it wasn't increased heart rate.
There you go.
Yes, I'm going to give you this
Okay.
to wear.
I don't want to wear it, but I did last time. You can see it. Okay, anatomy and physiology of the heart. Who can help me out? Who's read their chapter? No, not you. You read the first page, okay. All right. So what are the top, what's the top part of the heart called? The very top? Atria or ventricle? Atria. The top 2 are the atria. What about the bottom 2? Which one are the pump or the push out to the rest of the body? So if you don't have your left ventricle and you're having an MI, what's going on? What's their blood pressure doing? If you're having a heart attack and it's in the left ventricle, what is their blood pressure doing? It's going down, because that is the pump to the rest of the body. If you don't have your left ventricle, if you killed your left ventricle, you got nothing. So if you run up and grab a nitro and stick it in there and their blood pressure is already 60 over nothing, we ain't gonna get that back. And I know nitro is what you guys are taught. I'm just saying, be ready for some things that people ask, why'd you give nitro? Check your patient, vitals, blood pressure, pulse, all that stuff, okay? All right, I'm not gonna harp on you. I just wanted to go over that. What is acute coronary syndrome? What is that? What does that mean to you? What does that mean? What is that? Okay, all right. Okay. Yeah, it's a cardiac compromise. It's a STEMI, it's an MI, whatever you want to call it. Do you guys know what MI means? AMI? You know what STEMI means?
Can we go over that, please?
Okay, yes. Okay, so AMI, or acute myocardial infarction, is also called a heart attack. It's a blockage of the vessels in the heart. A STEMI, let me find my thing here. A STEMI is where it's blocked in the heart. But you guys don't need to know that, but that's what STEMI stands for. So if we have this here, it's an ST elevation MI. So I'm looking at that as a paramedic, saying that's a STEMI, which means an ST elevation MI, a STEMI. Means a heart attack, means the same thing, okay, as an MI. Okay, so don't worry about the STEMI part. I just want you guys to get some knowledge of when we're talking. Tanner and I are talking or whatever, and we say we got a STEMI, that means we got to hustle, because we've got 90 minutes to get them from wherever you're at to the hospital to Casper. And we can do that. We've done it in 60 minutes, depending on where you're at, of course. But we've got a STEMI, the heart muscle is going to start to die if we don't get to the cath lab and get that clot broken up. Okay? Does that make sense?
If you're with any of our guys here and you hear the word STEMI, understand that your patient is not coming off.
No, it is not.
They're going to stay on
Yep.
that cot during their whole ER visit, because that ER visit is maybe 20.
Maybe.
Because they're already on the phone with the hospital to get transfer orders.
Yep. All right, let me bring this up here.
So, would that be a case if we don't have a STEMI, we'll pick them up, we would just go ahead and traffic to Casper?
We have to stop here if we're coming through. Now, if we're on the other edge of town, if we're going towards Glen Rock, we're going to Casper. No, but the doctor has to give meds. The doc has to give certain meds that I can't give as a paramedic. But if I'm already on the way to Casper, I'm going to Casper. I'm not going to come back here to go to Casper. Does that make sense? Okay. All right. What are some of the compositions of the blood in the heart? And this is out of your chapter. I followed along with your chapter. What kind of nutrients do we need in the heart for the heart to function properly? And magnesium, yes, that's correct. What happens if we don't have the right amount of those things? Cells start to die, yes, like we talked about. You guys you were here last time. The potassium, if we have too much potassium, what happens? The heart gets floppier and floppier and floppier, and pretty soon it just doesn't work. Too little potassium, it gets harder and harder and harder, and then it won't pump. Okay, does that make sense? So we have to have the right amount of potassium, the right amount of sodium, and I don't mean salt on your French fries. I mean sodium in the blood, Na, to exchange with the potassium. They exchange equally. Okay? And everybody laughs at me when I say this, but the way I remember it in my head is a banana is potassium, right? We take that for muscle cramps. You salt your banana, what happens to the salt? It gets soaked in the banana. It exchanges. It exchanges in the heart. That's what happens. It has to have one to do the other. You just have one inside, one outside, and nothing's happening. Ain't nothing happening. Does that make sense? Okay. Blood in the heart. Blood, yes. Yep, that's what we're talking about today, okay? All right, I want to make sure I get all your stuff here that's out of your book so we don't miss anything. All right, let's do some electrical system of the heart. And that's what I gave you the RCAT for, the little yellow paper. The electrical system has to work in the heart from top to bottom, from atria to ventricle, okay? And I'll walk around here. You want one, Tanner? Sure. All right. So I'll get over here where y'all can see. It has to start at the top, okay? It has to start here, which is which atria are we starting in? Right. So your little electrical starts right here, which is the SA node, and you guys don't need to know that, but that's where it starts every time. If you have a regular heart rate of 80, that's where it starts. And then it propagates to the other cells, like immediately. Doesn't have to be told, it just does. And then it moves to the left atria, the electrical system's what I'm talking about. And then it goes to the ventricles. So it starts at the top, goes to the bottom. If it's working right, it does it every time the same way. Okay? Does that make sense? If it doesn't, and you see little extra beats or weird beats, it's not coming from the top, it's coming from someplace else. And be ready for that. Sometimes you'll see stuff that's like, I don't know what the heck that's doing, but it's coming not from a regular area. And I did give you guys some EKGs, I think. I think I did. Yeah. So the top one of your EKGs is your regular sinus rhythm. That's what you hope to see. Every time you put that on, your forelead, you hope to see. Yeah, here, I think I gave you the proper one. This next page.
Something to keep in mind is those
This
are
one.
tests, not-
That's the first
So
one.
can I ask you a question?
or even
So-
as
Yeah,
advanced
go ahead.
as
So this is
knowing what normal looks
what do you
like,
call it? SA node?
lets you know
SA
what
node or
not normal.
sino-atrial node.
You don't
When I
have
say
to
I
know
have a
if that
sinus
is, this is
rhythm,
eight, that is
you've heard
exactly
sinus rhythm?
things like,
That's
hey,
comes from the
that's
sinus
not right.
atrial
Tell
node,
the
which is
doctor, hey,
that.
it
right
looks
there.
really
So,
wrong.
but
I'm
my-
gonna send
I
it
mean,
to you.
this-
Tell me
this-
what it is. I'm
This
coming in.
line,
Mhm.
this chart that we're measuring.
Right.
That's the pump.
That's the pump.
Okay, so you're saying that if you see this bounce before here or wherever, that we're correlating that, because I don't know anything about this right now.
Right.
So I'm learning this.
Mhm.
If you have this pump, we can correlate that to its section of the heart.
Yes, yes, we can. Yes, and I can see that in my head every time because I've learned it so long ago. But yes,
Yes, okay, I'm sure
Yes.
you have, yeah.
Yep. Nope, but yes, that's correct.
Okay, now, okay, so you're gonna get into
Yep,
how we correlate these?
Yep, yep.
Okay.
yep, I am. That's why I said I hope you read your chapter because it's gonna get intense.
I haven't read the chapter.
Okay, well, we're gonna make it happen, okay? All right. All righty. Oh, yeah. Okay, so let's go with flow of the blood. This is in your chapter, the flow of the blood. Okay? And that's this guy right here. Okay? So where do we start? Let's start up here on the right atrium. Okay, we're going to start there. Okay? Then it goes through, let me think, the tricuspid valve. Okay? Goes through the tricuspid valve here into the right ventricle, right atrium, right ventricle. Then where does it go? From the right ventricle to where? Nope, it's got to go to the lungs.
Oh,
It's got to go to the lungs because you're getting deoxygenated blood on the right.
to the pulmonary artery?
Yep, it's going to go through the pulmonary artery to the lungs, then back to where? From the lungs, where does it come from? Goes into the left atrium, left ventricle, so we have oxygenated blood to pump to the body. Does that make sense?
Yeah.
Okay, the way I remember, and I went to school in Texas, so don't give me any crap. The way I remember your valves is toilet paper my ass. That's what I learned. Tricuspid, pulmonary, mitral, atrial, or aortic. Toilet paper my ass. That's how that's how I remember my valves. Okay. Yes, I went to school in Texas. It's like, oh, that makes sense. Okay, thank you. I love Texas too. I went to Texas A&M and it was great.
I wanted to go to A&M.
It was great.
I'm hoping to go to A&M.
Oh, you will love it. You won't want to come home.
Oh, I know.
I'm telling you.
I've visited so many times.
Okay, so toilet paper my ass. Tricuspid,
By what?
tricuspid, which is the first. Okay. Pulmonary, mitral, aortic to the body. Okay? Okay? Does that make sense of your how the blood flows? Okay. Yes? Did I lose
Where's
anybody?
I'm trying to see that.
Okay, hang on. All right.
Oh, right here.
Yeah.
I'm
Yep.
looking for the word. I'm looking
Yeah.
for the word. Okay, right.
Yeah.
Tricuspid.
Yep.
Okay. Okay.
Yep.
So
Goes
okay.
here.
Yep.
to
Yep. Right
here,
there, and then out.
And then to
Out
here.
to the
See this
pulmonary.
one?
Yep. Out the pulmonary.
Yep.
And to your
Back.
lungs.
Yep.
Come back right here.
Back right here.
To your mitral.
Yep.
So this here's mitral.
Mhm.
Right.
Mhm.
Left
Yes.
ventricle.
Uh-huh.
And out
Dude.
to your system.
To here and to your system. Yes.
Yep,
Correct.
okay.
Yes, you've got that. Does that make sense? Are we good? Did I lose anybody? Did I lose anybody there? Okay, did I lose anybody? Okay, all right. If I did, please tell me, because we got to get through this stuff and I don't want you guys to be lost. So let's see. Got that. The only job of the heart is to pump. That is its only job, is to pump. To make you happy, to pump. You can take the heart out of the body, take care of it, make sure it has all the nutrients, everything, and it'll still pump over here. That's how they do heart transplants. It'll continue to pump because it don't need a brain to think, which is awesome. Okay. All right. When we say STEMI or MI, we're talking about blood clots in the circulation of the heart. Okay, that's where the clots are. That's where they're not getting oxygen because your right coronary artery, your left, or your circumflex, whatever, has got a clot in it, and it can't get any blood flow to that part of the heart. So therefore, that part of the heart is dying. If we don't have oxygen for the heart, it don't pump, right? Okay. So when you say STEMI or MI, that's what that means. We need to get up to Casper to bust that clot out to make them happy, okay? All right, and I don't know if this is on your test, but it said there are 700,000 MIs a day in the country. 15% of those die. We are going to be the ones to help that not happen. We need to recognize something's wrong with this person. They're having chest pain, they're pale, they're cool, they're diaphoretic. They look like crap. We need to get everything on, get the pads, patches on, and go like heck. What med are we going to give if somebody's having chest pain? Aspirin. How much aspirin? What questions do we want to ask before we give the aspirin? GI bleeding. What else? Allergies, blood thinners, right. If they are on blood thinners, what can we do? Can we still give the aspirin? If they're on blood thinners, what can we do to maybe, can we check with our medical director? They're on Plavix, they're on whatever, can I give 2? Yeah, can I give 2 instead of 4? I mean, just ask your doc. But they need to have that because that works on the vessels of the heart, that aspirin, okay? All right. I don't know if this is in your test, huh? I don't know if this stuff is in your test because this is more of the coronary arteries and more of advanced, but when we have a clot, which one is the widowmaker? This one right here. The right coronary arteries blocked, that's your widowmaker. Those one of those people that just go drop dead. Because why? If this is blocked right here, what's it getting blood flow to? The ventricle. That left ventricle's right there. If they ain't getting it, they ain't getting it. All right, so I had a heart attack when I was 48 out on the scene of a call, which is bad, but I did. I survived. Carlos, my buddy, had a heart attack. He died 3 times. We got him back. I had to do CPR on my own partner. We got him back. Which one of you guys is more likely to not survive if you have a heart attack right now? Younger ones, because they don't have time for these coronary arteries. They will route themselves. If they have a small clot, not one killing them, they will reroute around that clot and reattach. The heart is so smart, it can heal itself if you let it. But if you're younger, it doesn't have time to do that. Carlos's heart has all sorts of extra stuff because he's at 90% occlusion and he won't have open heart surgery. He doesn't want that. So the younger people don't have time to reroute that. The older people, your heart's already rerouted around that bad stuff if it can, if it's able to.
Oh, baby, you're good.
Good.
Can't get rid of me.
Me on the other hand.
Okay, how does the normal function of the heart and blood vessels relate to blood pressure and pulses? What do I want to know when I'm checking for a pulse? What do I want to know? If it's present, if it's strong, is it regular? Is it weak? Is it thready? Okay, and what else am I doing when I'm doing this? Okay, rate, right? What else? What am I feeling? temperature? Are they diaphoretic? You can feel that. If they're sweaty, it's cold out and they're sweaty. Yeah, and they look like crap. They're pale, cool. They're probably sick. Let's get going, okay? How is shock related to the function of the heart? What happens if you're in shock? What if your blood pressure is 60 over nothing? What happens? Yeah. Yeah. So what's your heart saying? Your heart has to take care of itself. They don't have this to tell you. So if you're losing blood out here somewhere, what's your heart doing? It's beating faster because it's like, wait, I don't have enough pressure. I gotta go faster to get more pressure, but your more pressure you do, more faster, you're bleeding out. Okay. So what is the definition of shock? You guys know that from your test?
Lack of perfusion.
Lack of perfusion, right. So if you're bleeding out and your heart's pumping to make you better and you can't make you better, you're in shock, okay? Hi, guys. Wait, we took a, hold it.
Oh, I thought that was the rest of the event.
No, I'm not for Bree and Hannah.
No.
So that the film is-
We haven't seen Hannah yet.
And if you want any of what's left in that, then I do it before Hannah's back. She said he's hungry.
It's good.
I will show Santana through the floor.
Yes, Tanner,
Yeah.
yes.
He just ran out to get stuff because he might be on secretary.
Being quiet or?
Oh, he's being Tanner, but he doesn't bother me. I understand Tanner, it's fine. He doesn't bother me. Acute coronary syndrome, sometimes called cardiac compromise. Okay? We talked about that, STEMI, NMI. What is hypoxia? What's hypoxia? Lack of oxygen. And it's also called ischemia. Okay? All right, so you get to your patient. They say they've had chest pain about an hour. What do you look for? You're walking up to the scene. What are you looking for? Color, position they're in, right? What does your patient tells you they feel like they're going to die? Believe it. Believe it. If they are sitting there, they've had chest pain for an hour, and they're sitting like a tripod position, and they say, I feel like I'm going to be dying, be ready, because they're about there. They can sense it. Their heart's not beating, their brain is not getting blood. Brain has to have oxygen too, and if it's not working, this is not working. That's the deer in the headlights. Oh crap, let's go. Right, girls?
Isn't she already caught one of
We haven't yet. No, we're busy. Yeah. Can be described as pressure, squeezing, aching. I've had an older lady in her 80s said she's had jaw pain, tooth pain. She has bad teeth. Guess what? She was having a STEMI. It can radiate to the jaw, to the neck, either arm, doesn't have to just be left, upper abdomen. All right, what are the two-ish people that won't show many symptoms when they're having an MI? Women and diabetics. Okay. What is dyspnea? Yep. Why are they short of breath? What do we go through with the heart here? Why are they short of breath? Are their lungs perfusing? Because their heart's, yes, their heart's not beating very well. Their lungs are not perfusing very well either. They're going to be short of breath. They may be short of breath because they don't want to catch their breath because it hurts too bad to take a breath. Okay. Nausea, vomiting. I want to see you guys on your first STEMI call and you get puked on. That's always fun. Syncope. What is syncope? Fainting. Okay. Sudden onset of sweating. It's cold outside, but they are just dripping wet. You can't even get the dots to stick because they are so wet. Okay. That's why I said always check the pulse, abnormal pulse. What's tachycardia? What's bradycardia? So what's tachycardia? What rate is that? Okay, what about bradycardia? Okay, and what else are you checking for? Regular or irregular? Okay. Abnormal blood pressure, really high, really low. Okay. Why are they feeling anxious? They have impending doom. Why? What's happening to their brain? It's not perfusing. and they're scared to death. They're gonna die. Okay, so what do? We do our assessment, always. Okay. OPQRST, always. Check their past medical history, see what meds they're on. Take your vitals. All right, are we gonna hook them up to the monitor, JJ, tonight? Are we gonna show how to do that? I don't know what you guys need to do. Okay, well, I didn't know if we needed to show dots or not. I wasn't sure how to. I didn't plan on. Okay, I wasn't sure.
If you have time, if not, then
Well, I'm trying to get through this. I have all my notes and I want to make sure I'm doing everything that they have in their book. All right. Do that. Do that. Okay, so it's in your book, but I don't know if it's on your test. What is this sign? You'll see a lot of people, you walk up there leaning over or sitting over. What is this sign? Levine sign. You'll see that a lot. I didn't think you would, but when I had my heart attack, I don't know why, but it sure helps to push right there. Okay, so Levine sign. Pale or gray skin, like gray, like this color. Okay. So you're doing your exam and you got pulmonary edema. What is that? Swelling of the pulmonary is what? Lungs. So what happens? What's going on in the lungs? What is edema? Fluid. So you're going to have what kind of lung sounds? Huh? Yeah, because you got frothy sputum. You got frothy stuff in here. Okay, so your right side of your heart, okay, goes top to bottom to left. Your right side of your heart, if you have right-sided heart failure, it's the rest of the body are right. If you have left-sided heart failure, your legs will be swelling, your body, these extremities. Right is rest of the body. Left is lungs, or rest. Does that make sense? Why would left be lungs? It's coming to, yeah, and it can't because it's not there, so it's stuck. Yeah, so it's going to fill back up in your lungs because it can't go. So you're going to hear crackles. You're going to hear frothy sputum. It's not like they have pneumonia. They just can't move anything. Nothing's moving. Yeah, nothing's moving. Does that make sense? Okay, what are we looking for? Look for your medical alert, your swollen ankles and feet. Okay, we're looking at your whole patient. Do they do the 12 lead? I mean, I don't assess, but do we need to know how to do the 12 lead? Okay, so do we have that tonight so we can put it on? Okay, all right. You cannot interpret, but we're going to show you how to put it on. We're going to show you how to put the 4 lead on properly. So that can be done. You can put it on and you can send it to the ER. Hopefully you guys won't be having to do this by yourself as basics, but you know, if things hit the fan and you need to send it to the ER and the doc says they're having a STEMI and you're at Glen Rock, go to Casper. Don't go back here. Okay. Uh-oh. Oh, I forgot about that. I hadn't heard that in a while.
uh-oh.
I hadn't heard that in quite a while. All right, we're going to place electrodes on the chest. We'll learn to do that. They need a secure contact with the skin. That's why I said when they're really, really, really diaphoretic, you're going to have to get them dried off. Get a towel, get a shirt, get alcohol rubbies, whatever you need to do, because they have to stick to be able to read, okay? Remove clothing and jewelry. Why? What if they have nipple rings? What the hell? You got to take them off. You got to. Sorry, it's got to happen. Okay. Yeah, I've seen them spark, and it's not pretty when they spark. Yes. Yep. Remove hair. Men's with hairy chest have to be shaved. or if that doesn't work and you have 2 sets of pads, put the pads on and you rip them off and put another clean set on. But they won't set right if you don't. Okay? Look for somebody with a pacemaker. Where should your pacemaker patch be? Should be here, right? So we're going here and here usually. Doesn't mean it's not over here. It might be if this didn't work and they had to move it. Don't put your pads over a pacemaker or any other port for that matter, a cancer port, anything that's here. You got to go way below it. You can't, I mean, not way below, but below, not over the top of it. Or go front to back if you can. If you can get them rolled, go front to back. Okay? Did I miss anything, Rachel? Okay. Huh? All right, we got to do that, so we'll get to that. All right, you guys want to take a break for a second? We got to get through this. Okay, cool. Take a break and then we'll do that so we can get where we need to be. Did that. How are you, Miss Rachel? Good. Did that.
If they would have said it wasn't good, I've been informed.
I got a lot of new stuff.
I just saw the one over here. I was like, oh my God. I want new ones. Where are you getting them done?
Joe. Joe, here in town. I like this guy.
That- That is adorable.
That's me. I'm the road runner. Yeah, I got a lot of new stuff. Some you can't see, and I'm not going to show you right now.
My daughter's headed David's going to get hers finished up tomorrow. Because they told her there's only 625 people diagnosed with her disorder, so she's 626, which is Stitch. So she got a tattoo of Stitch.
Well, that's pretty cool.
She gets the coloring done tomorrow.
Well, very cool. Awesome. Am I making sense at all? Going too fast or going too?
You're awesome.
Okay, all right. I just want to make sure I'm not missing something in your book.
I don't know. I'm learning a lot.
I love cardiology. I love it, love it. That's my
But,
most favorite thing. I understand. This is a really good one here. Goes with this, and that's a really good workbook just for you. Yeah, but it has all the same things, but it has a little workbook where you can work through it.
Okay.
It's kind of a handy little thing. Remember this one, Rachel?
The idea of the heart, it's just so easy once you get the basic of how the heart
Works.
works through the body. The little stuff that
Yeah.
the cardiologists learn that you're like, yeah, that's cardiology.
I love it. I love to learn what they learn. That's favorite thing for me.
So like, coming back to the lungs, when you get that draw on the pump, and
Uh-huh.
then you're pumping out to the rest of your body, like you're basically pulling a kind of a suction
Yep.
on your lungs,
Totally,
right?
totally.
And
Mhm.
then boom,
Mhm.
contract, and then
Yep.
that's what I see.
So when you're doing CPR, when do the coronary arteries get perfused? When you're doing this, when do they get perfused? They have to be perfused
No,
too.
on your back up.
When you're going up, yeah. So come off
Yeah.
the chest.
Yep.
Make
yep.
sure you come
Gotta
off the
retract
chest.
the
You
chest
got to
needs to retract.
yeah, so that you can get that suction
Yep.
to get blood
Yep.
into the heart. Because if the blood is not in the arteries, it'll do no good. Yep. Yeah, you'll see a lot of people keep their hand on the chest. Just gonna pick that up so
I
that
know
it,
when
can,
I've done CPR, I make sure my all my hands.
it comes
right-
up.
right
Yep. That's when the coronary arteries get perfused is in the up.
And that's a good thing about having, SWAT stations on CPR too, where
Uh-huh.
you can help coach each other. Hey, you're
Yeah.
doing good. Hey, you need to come up a little bit.
Well, I
No,
love
I'm
it.
looking forward to getting my head wrapped around the whole thing.
Yep.
We didn't have any fire help on our coach the other night.
Hey, I was here.
You're
I was
wrong.
by
You
myself.
should have come down.
I can't.
You can't?
No.
You can, you just have to call a, officer.
I tried calling an officer.
It
No
was
answer.
me, a
Okay.
basic, and two
Call an
police
officer, call
officers.
two. If no
Call me.
answer, you can.
Call me.
I
At
was
dispatch, I
very
asked for a
busy.
second dispatch and I called an
Say,
officer.
hey,
I said, they go, the cop was, you wanna just go? I said, I'd really like fire, I need some help, and I heard him page fire, and I was like, they're not allowed.
So you heard the second page?
I
right?
heard the
You hear
second
me out?
page.
Ask for second page?
All I heard was the page, I didn't hear anything else, and so I was like, okay, we're BLS in the rest of the way. I already did the drugs that I could, and we BLS.
we'll just go, huh?
I had no choice.
Yeah.
It was. The scene itself was not very.
That's what-
Well, that sucks. I'm sorry.
I'm not. He
You
did
could,
it to himself.
you could call me. I can't work anymore, but I could come do something.
So what happens if you have someone who's got nipple rings and you need to do
You gotta take them out. You gotta take them out. I always carry my
pliers?
pair of pliers in my pocket. I always carry my pair of pliers in my pocket. Always. Always had them when I was on the ambulance.
for wire cutters?
It's fun to watch them spark, though, if you want that to happen, but you know, it's probably not good if families watching it happen.
If I'm on, I don't have wire cutters, and I don't take time.
Yeah,
You're getting sparked.
you get sparked. It's
I
kind of
don't
cool.
care.
Do you have like a burn mark?
Your
on
little
it?
Yeah.
burn marks are going to not be a priority over your heart work. for
Yeah.
mine- For me, but that's because I don't carry that. So. Oxygen.
Did you bring it? I gotta go get it. I can't get in there anymore. Perfect.
Clear.
Clear. All right, somewhere in your paperwork, I did copy a smaller one of these, of the regular sinus rhythm. Okay, he was asking, how do we know in the heart when there's something not right? This is a regular sinus rhythm, the very top one. So I'm just gonna go through this. It's not on your test, but just so you know, okay, so we'll start here, just because. This right here is called a P wave. This little one right here, this little one, what is that? That is your atria working. If it's upright like that, that's your atria. That's the top part of your heart.
This little one?
Yeah, that one right there. Yes, that little one right there. And that's not on your test, but this is where your SA node
Do we say
starts. And that's the right here. Remember where your SA node started, where I told you that?
Yep,
Yeah,
yep.
it's this,
Okay, that's that.
this right
Okay.
here. Okay.
Okay, I gotta write that down.
Okay. Okay. All right.
The SA note, right?
Yeah, that's where it fires. That's that P wave. Yes. Yes. Yeah. Okay. All right. So when that SA node, it goes from right atrium to right ventricle, or right to left atrium. So it goes like that. So it's not like it goes down and back up. So it goes right atrium, left atrium. Okay, it propagates all the way across. Okay. Okay. Then the next big one you see is this, right? Right? Okay. That's your ventricles. That's your ventricle pumping. Both ventricles. So this big tall one
Oh.
right here. Yeah. Yeah, that's your ventricle. So if we're going right to left, okay, I'm just getting this in your head. Right side, left side. Right.
Right here, right side.
This is your SA node, remember? Right
Yep,
side of your
SA
heart,
node, yep.
left side of your atrium. Right side of your ventricle, left side of your ventricle. It's got to have an up and a down, right?
Yeah.
Okay.
Okay.
Okay. Does that make sense?
Yes.
Yes. So it's not that hard to see it. If you look at it and you've got a pulse with that, it's like, I got an atria and I got a ventricle. Okay, what's my rate? What's my rate on here? 70-ish. I mean, I'm just looking at the top part of this thing right here. Yeah. So is that in the middle of where it should be? Regular rate? 60 to 100? We're happy camper. That matches that. That looks upright, upright, upright. We got up, down, up, down. We're happy. And we got a pulse that matches that. What if we don't have a pulse that matches that? And you see this. Holy crap. Where's my pulse? There's got to be a pulse. You will see this sometimes, people. It's called PEA, pulseless electrical activity, and you'll see these guys' face go because they got no pulse to match this. So always, always, always check your patient. Don't just look at your monitor and say, well, he's got a pulse. He's unconscious, but he's got a pulse. Yeah, yes, but he's hooked up correctly and there is no electricity flowing. You got this, you got no pump to go with it. Yeah, there is such a thing. It's scary. So anyway, does that help? It's not on your test, but I just want to give you an idea. Okay, okay, all right. Sorry about that. I jumped ship for a minute. I'm back.
They said, we've had students reporting back to us that there are rhythm strips.
Well, I did all the basic ones. So let's go through that. The very top one is a regular sinus. Let's go through that since we're going through it. The next one, how fast is the next one on your paper? How fast is that?
140.
So that's above 100, correct?
Can I ask, I'm sorry.
Yep.
How are you getting? Because it says heart rate. HR.
Oh, okay.
Yeah, we're just going by that for now.
I was trying to find a grid here. Like
Yeah,
X,
no,
Y
we're just
axis.
gonna do that right now. I'm not gonna do that to you. So we'll just
Okay,
do
okay.
the numbers right there.
Okay.
Okay, I'm not gonna do that to you as a basic because that will go, what the heck did she say?
Okay.
So that is, do we have a P wave, what I talked about? Do we have a little blip before the blip? Got a little blip, see that little blip?
Yep.
Do we have it up after the blip?
Yep.
So we got sinus, it's coming from the SA node, it's coming faster, but it's coming from the SA node, right? And it's got a blip. So we got sinus, heck. Does that make sense now? If you got the little blip before the QRS, then you've got a sinus heck. Okay, what about the next one? Okay, well, it's 34. Do you have a little blip before the ventricle? Yes, all the way across. Do you have a pulse with that? Yes. So we got what? We have sinus, because we have the little P wave, sinus Brady. Yes, because we have a P wave. And because we have an upright. So you got a P wave and sinus Brady, and it's less than what it should be.
But is it just cardiac, bradycardia?
Yep.
Yeah.
Yep.
Okay.
That's it.
Okay, you have to have this for sinus.
For sinus.
You-
That
you-
has to be a
that's top
sinus.
your-
That's the
Your SA
sinus.
node.
Yeah, if that's not there for whatever reason, there's no sinus. The
And-
sinus
and-
is not working.
If that's not there, you got brady.
You got something else, but you don't have sinus.
But you do have, if you do have your ventricles pumping
Yep.
here and no sinus, you're just bradycardia.
Yep.
That's it.
Yep, it can't be sinus if you don't have a P wave.
Yep. Okay.
Okay, that makes sense? All right. Did I lose everybody? Okay, what about the next page? Holy macaroni, what is that?
Questionable.
Questionable, very, very questionable. Yes, it is. So what is the,
Whole bunch of sinus.
and a whole bunch of mess. There's no organized rhythm, is there? There's an extra one right there. You want it? Uh-oh, you're wanted. Your phone's ringing.
Somebody's at the front door.
Oh, Tanner, don't let him in. Okay, so that, should be. I had to come in down there.
It's what? Oh, it is? I put the reg in there when I came in.
It was there when I
still
came in too.
So the next one is VFib. We ever heard of VFib? Ventricular fibrillation? Your ventricles are just doing this because they got no electricity. They got nothing. So they're trying because your SA node is dead. It's done. Top area of your heart's done. The ventricles are trying to get something to happen, but that is VFib. What do we do with VFib? This is what it'll look like. It'll be, there's no organized rhythm to it.
That's a shock word.
That is a shockable rhythm, yes. Yes, but they will have no pulse. And if you have that on somebody and they have a pulse, it is not that. Okay. So don't let somebody tell you, well, he had a pulse. He didn't. Because
On a VFib.
on a VFib,
Yeah,
you will
no.
not have a pulse on a VFib because it's only the bottom part of the ventricles that are trying to do something, and they have to push up because there's nothing coming from the top down. They have to go up. Well, they got to go through a lot of muscle to get up there to do something. So,
Yeah,
okay, so we got to shock that. Okay, what about the next one? Huh? No. Next one. Do we have a sinus rhythm in anywhere in that? Do we have a little
It
P
kinda
wave?
looks like you got a little
You-
blip right there.
Where's a little bloop? You show me.
I'm gonna say this.
You gotta be before it though, right? Not after. Right? Look at your other one.
Okay, oh, yeah, right.
Yeah, there's nothing at the beginning. Nothing at the beginning.
Okay, so.
Can't be
okay,
after.
Okay, so we are calling
Yep.
this a ventricle,
It's a something.
yeah, we're calling it, so,
QRS
ventricle
like that.
pumping,
Yeah, but it is
So this is-
only that. And look how wide that is. So it is the bottom part of your heart attempting to get the electrical system back up. It is getting wider and wider, and pretty soon you're going to have asystole. You're going to have that because it is getting so wide, your QRS, which is right here, getting so wide that there is no electricity that's going to happen. I mean, your atria is not working. Your ventricles are getting tired because they can't do anything because nothing's happening. This is called idioventricular rhythm, or just your ventricles trying to beat. It's not VFib because it's not like this. It is just your this one, idioventricular or IVR. That's what this is.
so,
I-
80 what?
IDEO,
Oh, ideal.
ventricular, which
Okay.
is that
Yep,
rhythm, or IVR.
or IDR.
Yeah, because it's not VFib because it's not doing
Mhm.
this. It's
Idioventricular
just that
rhythm,
your
yeah.
ventricle is trying to
And
help.
it's getting tired.
It's getting tired. It's worn out. Okay, so the next one at the very bottom. Where are you going? Ugh. Okay, so what's the next one? The bottom one.
You just said.
What is it?
I don't remember what. you-
Asystole.
That's what this
You
is.
guys, would you guys make sure we're not. Clean up a little bit, put these away.
Yeah.
Yes.
And that monitor goes on tonight.
Okay.
Got it.
Thank
Have
you,
fun at
guys.
WBI. I miss it.
ready?
Not. Okay,
Hey, what?
asystole. Without systole, without a rhythm.
I don't know if I spelled that right, but no rhythm.
No rhythm. Can you shock asystole? No. Why can you not shock asystole? Nothing to shock. You got to have electricity to shock, right? And this may have electricity, but the asystole does not.
So the
Nothing.
IDR is a shock.
IVR?
Yeah.
You're going to do something. Yes, you're going to do CPR and you can attempt, but it ain't going to do anything because the ventricles are done. You're going to go into a systole here in a second. It's going from dead. Yeah, it's going dead. That's why I put them in that order. You're going to get that to that. Okay, does that make sense? Did I lose everybody?
It makes me feel better
Understand the basics.
like going through this, for like when we're on calls.
Okay, sure.
Yeah.
Yeah.
That
Just to
was
like know what
helpful.
to expect.
Because I have a strip in my
We are. in
bag,
class,
and I
we're
have a
on our
strip that
phone.
Jim did in my car for me,
Okay.
and none of it made sense. He was trying.
Yeah.
I give him credit. He
Yeah.
was trying, but it was not.
Yep. Well, I love it. I love cardiac and I understand cardiac. Okay, where are we at?
Remember that guy who goes to go on
All right, we're gonna do that in a second. Let's get back to past that.
Got the lead on my ankles.
We'll come back to that, okay?
I think he had some.
Okay, so we're going to place our patient. We walked in, he's pale, cool, diaphoretic, looks like heck. Gonna put him in a position of comfort. Are we gonna make him lay down? No, why? He's already anxious. We're gonna stay. He's already probably having trouble breathing. He's upset. Let's set him up in the cot as best as we can, comfort the patient, and just make him feel comfortable, okay? Don't say you look like hell or uh-oh, or don't look at your partner like, okay? Determine if oxygen should be administered. What is your oxygen? What percentage should you give oxygen? I'm talking in 94. And that's in your book. So 94%. If they're perfusing enough and they're at 94, no oxygen is required. If they're below 94, put them on a couple liters. And that's per your book. Okay? What is respiratory failure or agonal breaths? What is that? Gasping. You may walk into a house sometime, patient is sitting in their chair, clutching their chest, and you hear, that is agonal breath. Doesn't mean they're breathing, doesn't mean they're perfusing. Get them on the floor and start CPR. That is not a life-sustaining breath, okay? I've heard that before. It sounds like they're breathing. No, it's just their last gasp, but I'm trying to get something in and ain't nothing happening. What's apnea or apneic? What does that mean? No breathing, without breath. Then what kind of oxygen are you going to put on? You're going to get BVM because they are not, if they're apneic, you need to get a BVM. Okay, all right. Yeah, well. We're going to teach you how to do the 12 lead. That's what JJ wanted. And then they'll show you how to transmit it to the hospital. Okay. All right. You're going to do what? Okay, we're walking up to our patient. Pale, cool, diaphoretic. Go. Pale, cool, diaphoretic patient. Chief complaint, chest pain. Looks like heck, but you're not going to say that to your patient.
Gather history.
Gather history. What are you going to be telling your people here? They're here to help you. They can't do it. You're the EMT. They're going to help you, but you got to tell them what to do. And we're just practicing. It's fine.
You got me nervous now that I'm on the spot. You approach them, tell them who you are, what you're doing.
Right.
Ask if you can take the vitals.
Right. So you reach down and grab a wrist. What are you looking for in the wrist?
You're feeling for pulse, their temperature.
Okay.
You're gonna be looking at their respirations while you're talking to them.
Correct. Okay. What about you? Next. She's done that. Your turn.
Okay. Now you start history. So PQRST
Okay.
and sample.
And she hollers at you. Their SAT is 92%.
Okay, so from oxygen,
How much?
10 to 15 primary breather.
Let's do a nasal cannula because these people are already scared to death. And if you start grabbing a mask and coming at them,
That's
now if they're at 85, I understand that.
Yeah.
But if they're at 92, let's get a nasal cannula. Just tell them, I'm going to put a little oxygen on you. This is our protocol. We just got to put a little oxygen on. We're not going to scare them. Put that on them. That helps a little bit. Okay, because you're doing something. They're sitting there looking at you like, do something.
Yeah.
Okay, so you've done that. Your turn.
Oh, sorry.
We got the oxygen. They're checking vitals. What do we want to know about vitals?
Heart rate.
Heart rate is 42.
Oh,
sustainable.
Don't listen to him. He's not even here. He's the old cousin that we don't listen to over here.
He thinks he's
We're getting the cot. We're rolling.
Okay, well, we're gonna do it calmly. We're the calm in the middle of this storm.
Oh, yeah. No,
Yeah, because
well,
I've
okay,
been
one
to
of
the
things
I've been to the truck
let's solve
stop.
the firefighters
There you
and
go.
then,
Perfect. I've been to the truck stop and the lady was having chest pain, but she was going to continue to eat her soup because she wanted this soup that's only there once a week. And I reached down and grabbed a pulse and it was 38. I'm going to eat my soup. No, you're not. But okay, can we take the soup to go? So all that is like running through your brain, like, is she going to code any minute here? I don't even have an EKG yet, and we're at 38. So, yeah, be ready for that. It's fun. I love my job. I wish that I was still doing it, but all right. So 38.
Blood pressure.
Blood pressure 80 over 40. Are we going to give nitro for chest pain? What does our nitro protocol say? Did you get those papers for nitro protocols?
Yes.
Help him out, guys. What does our nitro protocol say? Huh?
1200.
Below 100. So it's 80 over 40. At, what did I say? 42?
38.
Okay. Yeah, it's fine. It's fine. It's low. It's low. We don't care. Okay.
So we've got oxygen started. We need to get some oxygen.
Anybody call for ALS here?
Call ALS.
Okay, done that.
Medical support.
Okay.
Get the approval of nitro.
Are we going to give nitro?
Oh, baby. Yeah.
Perfect. We're not going to give the nitro because everything is low.
Give an aspirin.
Cool.
Gonna get probably 4 pills as long as they
But
take
I
it.
take a blood thinner.
Okay, then they're not dumb too.
Okay, okay, just be ready for grandma.
And, yeah, and I know, Amy said get going here, but yeah.
Yep.
Well,
Yep.
if they wanna get going.
Are we gonna run emergent to the hospital? She's talking to you right now. Yes, her heart rate is low and her blood pressure is crap. Are we gonna run emergent to the hospital?
She's not stable, not really stable.
Her heart rate is low, but she's still talking to you. Is she perfusing up here?
Yeah, she's still, she's not disoriented, she's mentally stable.
Mhm.
And I'd say probably not emergent.
Right, because what's that gonna do to her heart?
It's just gonna get her nervous.
It's gonna make her nervous, like, why? And then what's gonna happen?
Yeah.
Okay, so what meds could she be on to cause the low heart rate and the low blood pressure? Because we are just now getting all this stuff done. What did our assessment?
Cholesterol?
Huh? Beta blockers.
She's on them, guys. She
Yeah,
knows.
so you got a car crash and you're scared to death and your heart rate is only 62. Check for beta blockers because it can't come up. It cannot come up. Your heart rate can't. You're blocked. The way you know beta blockers, beta 1 is your heart. So if they're on a beta 1 blocker, your heart. If they're on a beta 2 blocker, lungs, 2 lungs, 1 heart, 2 lungs, beta 1, beta 2. Remember that. So if they're on a beta 2, that's your lungs.
So dumb question, what's beta one?
So-
Beta 1 is the OL, metoprolols, the OLs. If you got anybody and you're looking at their meds and their OLs at the back,
Yeah.
that's a beta blocker
Okay, but why?
to keep their blood pressure down.
Okay, okay.
That's what it
Okay,
does.
so that's-
No, that's okay.
It's
It's a
high
good
blood pressure
question.
med.
Yep,
It's a
that's
high
a
blood
good
pressure
question.
med. Okay.
Yep, that's a good question.
So there are beta receptors and there's alpha receptors in the body.
Yep.
They work on the sympathetic and parasympathetic.
Don't scare them. Don't scare them yet. Yeah, you have.
I figured you have, just trying to like.
But
kick
it
it back
is,
into Right.
huh? Eliquis is a blood thinner. Eliquis is a blood thinner, so you're gonna ask that too. What kind of blood thinner is she on? Because Eliquis is a blood thinner, okay?
Yeah, so I mean, if we say, if we have a beta blocker and a blood,
Uh-huh.
then yeah, we're not gonna go with 4 aspirin.
So we're gonna go 2. But if she's stable and still perfusing with a blood pressure and with a heart like that, let's not scare her. If it's a low grandma, maybe that's where she maintains. Yes, she's having chest pressure, okay? But why? So what if she's on nitro? What if one of her meds that she says, I take that little white pill? What does that tell you?
She has a history of
History of cardiac, of angina, which is angina, which is in your book, is chest pain that's relieved by relaxation or nitrodox will prescribe a nitro for angina. You get chest pressure, chest pain, you take your little pill and it goes away. That's angina. You take your little pill and it don't go away, it's probably a severe cardiac event. Okay?
So when we get loaded up, I'm thinking we go to 12-week right as soon as we get.
Mhm. Yep.
And so that's after we get loaded up.
Mm-hmm.
I think in this situation, right?
Yeah, let's not scare grandma. Take her soup to go, load it up. We're okay right now.
So
Yes,
doesn't warfarin have a different protocol for like nitros and stuff like that?
warfarin does, you can take 2 aspirin with that. Talk to your medical director. I don't want to tell you wrong. Talk to your medical director, but I can always give 2. It's not gonna bleed them out. Okay. Okay, does that make sense? Okay, because there's Plavix, there's warfarin, there's Eliquis, there's all sorts of blood thinners. And you guys learn all these meds here in this class, but there's lots of meds out there that you need to know. You know, and there's a little book, it's called a pharmacopoeia book. It's a little book, it's like $15 on Amazon, and it's just a little pocket book. And every year it comes out with the new meds. And it's really handy to know. If you don't know a med, it's like, okay, you can look that up really fast. And it probably comes on your phone. I don't know. I just always carry mine in my pocket. But it's a pharmacopoeia is what it's called. And it's just a little book and it's only about that thick. But all the new meds are in it. And that kind of gives you an idea of what med that is. If it's an OL, if it's a prill, which is all the ACE inhibitors are prills, which is blood pressure. All the OLs are beta blockers. It kind of helps when you learn all that stuff. And you don't need to know it now. Sorry, I'm confusing you.
On the app? Is it on the app?
Is it?
Wes has one on his phone.
Well, I'm sure he does.
Here's one color shade, 19 number. It's called the Pocket Drum Guide for Nurses.
I'll get that. Hang on. Let me find the. I'll find the one I'm talking about.
So how come you're not working anymore?
I retired. It was time. I'd been in it 30 years and I loved it and I would go back in a heartbeat, but it was time. 30 years was enough. Yeah, it is. I'm doing what I want now.
What is that?
I am doing woodworking, catering.
Yes, she does. I was thinking
I
that
seen
too.
those the other day.
It's the Tarascon Pocket Pharmacopoeia. And every year a new one comes out. So if you don't have to have it every year, but if you want to be updated on what meds, it's just a little pocketbook. And it's handy little pocketbook. And it doesn't cost you very much. I think this one's, you can get one for like $15 if you want to get the used.
See that?
I'm coming. I'm on my, hang on. Yeah.
Pharmacopoeia.
Pharmacopoeia book.
To be fair.
There you go. Top right.
2024.
Stop.
Which one's that?
Yep.
Oh, that right
Yep,
there?
that one right there. Yeah, it's just a hand. You don't have to have it, but I got one every year just so I kept up on the meds. And it doesn't mean you're on scene and you're looking through your book, not talking to your patient. It means when you get back to the hospital and you get their med list and you're going through it and doing your documentation and you don't know what a med was, look it up. Next time you will remember. If you can equate that med to that patient in your head, that helps to remember. And you don't have to know all the meds, but okay. All right, what's your dose for nitro? Anybody? Okay, what is your side effects for nitro?
Headache.
Okay.
Dizziness.
Hypotension.
That's the word I'm looking for.
Mhm. What do you need to ask your patient if you're going to give nitro? It's their nitro, right? We want to know our rights, right? Our 5 rights. What if they, have you taken one already? Yep. What? Okay, and what other med maybe they have taken? ED meds. ED meds.
OED meds.
You still got to ask those questions. You still got to ask.
Well, if you had, just look at.
Yeah. All right, I'm gonna tell a not appropriate story, but that's 30 years of EMS is 30 years of EMS, okay? Uh-oh.
Oh, Tanner.
Just to the bridge. I can do that. I'll do that all day long.
You're gonna be there.
Good luck.
Have fun. It was good seeing you.
It's to the bridge
Bye.
for now. For now.
Bye. Have fun at the bridge. I don't miss that part of this at all. All right, so this grandpa, we had to run on the grandma a lot, and I worked in Casper. And she would be low blood pressure. Every time we'd get there, she was in bed, low blood pressure, and her husband would say, I don't know what's wrong. I don't know. And we probably ran her 15 times. He said, the doc gave me some stuff for when we want to have sex, so I use it. But every time I do that, grandma passes out. He gave the guy nitro paste, and he was using that for that. And every time he would do something with grandma, grandma would get low blood pressure and pass out. That's not what that's for, grandpa. Okay, yeah, we finally figured that out after about the 15th time. It's like, no, that's the wrong stuff for that. Grandpa, don't do that again. You're killing your wife, okay? So anyway, that's some of the stuff I ran in Casper.
She had a killer time.
Yeah, she had a killer time. It's like every time we'd run on her, she'd be passed out. It's like, what the heck is wrong? Oh, don't do it again, Grandpa. Okay, so every time you can equate that with a patient, it's like, oh my God. All righty. Sorry, back to where I was. What is coronary artery disease? I gotta find my clicker. Here it is. Yeah, what is that? Okay, so what does that mean to you? There we go. So what about Carlos? Mr. Carlos, you guys know Mr. Carlos, right? He's an awesome guy.
Yep.
Does he have coronary artery disease? He has probably had 5 or 6 heart attacks. And I know 3 in one day because I did CPR on him. Okay, so his heart is damaged already. It has got disease. Now, if younger people just have a sudden heart attack, they probably don't have disease. They have coronary artery syndrome, which means they had a heart attack, but their heart is not damaged enough to be diseased. Okay, does that make sense? Okay,
So what's the, what?
a number of disorders affecting conditions of the blood vessel in the heart. So it's already, your heart's damaged. You're not going to fix that.
I need to know what type of thing.
We're talking about they've had a heart attack. We're talking of
So like the, so.
high cholesterol.
The left ventricle is not pumping like it used to. that
Yep.
kind of stuff, everything's
Yep.
weak,
Everything's weak.
Arteries are weak.
Yep.
And
Yeah, Carlos is at 90% blockage in his widowmaker, and he don't want that fixed. Makes me very nervous.
so, I mean, how do you fix that?
He needs open heart surgery,
Open heart
but he doesn't want that.
So how do you fix that over?
Hey,
Take a chunk of that
you
out or-
take that out and you graft a new one in from the leg or the arms. You've
Graft-
seen the
graft a big
people
chunk of
where,
artery in,
yep, you've seen where they've got scars here and here where they've had open heart surgery. They take the arteries here and put it in your heart.
And then just push those suckers
Yep.
together and sew them up?
Yep,
Okay.
Carlos doesn't want that.
You don't want that.
He doesn't want that.
Now, is there a reason?
He doesn't want that. He wants to live his life the way he lives his life. He doesn't want that. So they went in and they did a cath when he had his heart attack and they took the clot out. What the clot was for him is it was summer. He was very, very dehydrated and the clot was in there. And every time he'd take a breath in or his heart, it would clot. And then he would back out and then pop back out, the clot. And then one time he sucked it all the way down and it stuck because he was so dehydrated. So it did it till we got him to Casper. It would go up and that clot would go back down. And that it's already 90% occluded. If you include that, the other 10%, you're not perfusing. Yeah, that was not a fun day. That was a bad day.
So that's on the left side?
Mhm.
Okay.
Yep.
That's on.
That's
side
the one that's doing
pumping
your
up
left
your body,
ventricle.
the rest of the body.
Yep.
How do you go in and grab that?
Like, you go in, they put you in cardiac standstill. They go in, they take all these vessels, they graft it, they take the other one out, and they graft
So
it
how
back.
do they go in and get that clot?
They go in through a stent. You should go up there sometime. They'll let you go up there if you go volunteer. And they go in through a stent, through this right here. They go through here now, not down here anymore. They go through here and all the way to the heart. And they have a little suction and they suck it out. You can go watch it if you guys volunteer and want to go up to the cath lab. It is so entertaining. Those docs are awesome to train. I would, yes, I went up and trained up there because I loved it. You can see when they break the clot apart, they went go, and you can see all those vessels open up and everything get reperfused. It goes from gray to pink. Wow, that's okay, cool. And then Carlos, they went in, they just took it out, sucked out that clot.
So the clot that's in, like say like Carl's spot or that's on the right side,
Mhm.
right?
Yeah, I was in his coronary artery.
Corner already. So, there's no way to go in and like scrape that clot off the wall of the artery.
They can blast it out. That's what a cath is to blast that out. But for him, there's so much damage. He's got coronary, like I said, his arteries are so hard now that nothing's going to expand anymore because he's left it so long. If you fill a straw with cement for so long, it's not going to expand anymore. I mean, it's that part of his heart is not expanding. That little part is not. It's done. They got to go fix it. And he can't anymore. So
The only way to do that is
unless he goes a bypass.
the only way to do it is open heart.
Yeah, and he
You
don't
gotta
want
get
that.
in there, open it up.
Yep, and move that around it. And he doesn't want that. So that's his life and his choices. So, all right. Risk factors, heredity, age, hypertension. Why is hypertension cause you to have coronary artery disease? Right. What about obesity? All right. Lack of exercise, high cholesterol, cigarette smoking, bad juju. So are vapes. So All right. So this was the grandma I was talking about, the angina. So she has nitro prescribed to her because she has angina. Chest pain caused by insufficient blood flow to the myocardium or the heart. Okay. Due to narrow arteries, secondary to coronary artery disease. If she's up and moving around or whatever, she has pain. She can sit down, it'll go away. That's angina pectoris. She sits down, it goes away. If it doesn't go away right away, she's been prescribed a nitro, she'll take a nitro, and generally that helps. Okay? That makes sense? All right.
So the
Oop.
nitro, is the nitro just a pain reliever?
No, nitro. What does nitro do? Dilate your blood vessels in your heart. Opens them up. So you better be having your patient be sitting down because your vessels are all going to open and you're going to go to your feet.
Right, you're losing that pressure that
Your veins. Your veins.
Right, so, okay, so that's pain reliever.
Yep.
Less stress on your vein in your heart.
Yep. Yep. You guys need a break?
I'll just put on my face.
Oh, anybody need a break? Because we can take a break.
I could go take a leak.
Okay, take a break. Take a break.
Not a potty.
Potty isn't, that's important. Let's see. All right.
So when vaping started being like a super big thing, and then they had like all the deaths and like kids being hospitalized and stuff, my dad sat my brother and I down on the couch. And I've heard my dad use my first name 6 times in my whole life, probably. And he called us both by our first names. And he says, if I ever catch you with one of these in my house, or ever see you with one of these ever anywhere, I'm gonna get a carton of cigarettes. You're gonna smoke along in front of me. No water, no food, all at once. That was enough to scare us to never do it.
Well, vape is not dangerous. It's just about as or worse than cigarettes because there is nicotine in vape.
That was enough to scare us right there.
My dad told me if he ever caught me smoking a vape and cigarettes, his beat me for being a bitch.
That was the other part.
But he didn't say anything about chew.
So
That's been.
So you do like tutoring and stuff for this type of class?
Yep. Huh? Get a hold of JJ and she'll get a hold of me and I'll come help. Yes, you can get a hold of me anytime. 259-1236.
I'm thinking like for the National Registry, you might be
I love cardiac. This is,
a good tutor for.
yep, I love it. I love cardiac because it makes so much sense to me. And then if you go sit in the cath lab and you talk to the docs and you get to be friends with the docs, they'll fill you full of all sorts of stuff, which is really cool to me.
So if y'all want to keep up on that on Saturday, I'm free.
That's what I'm thinking.
And I'll make dinner. My whole home's up there.
There you go.
Fascination with cardio stuff, did it come after your heart attack, or was it like?
No, so when I first started, I started in Casper. That was 25 years ago, before I came in intermediate. So they didn't want to help me. Nobody wanted to help me up there. And they would just, you're on your own. I did a lot of transfers from here to Salt Lake, or from Casper to Salt Lake to Denver to by myself in the back with the patient. And I didn't know any of this stuff. That's not good for my patient. And in my head, I'm thinking, well, I better learn this because if I have a code on the way and I can't say, well, I don't know. So I went to every book I could get. I went and sat with the docs. I talked to the docs. I went to the cath lab. I volunteered in the cath lab. I want to know why the heart does what the heart does. What did I do wrong or what did they do wrong? Why is this not doing this? You know, I mean, that I can look at a cardiac rhythm strip now, anyone you show me, and I can tell you what the heart's doing because I learned that myself. I taught myself.
So why did you have a heart attack?
I had a heart attack on scene out here at the 146. They said it was from stress. They said your job is too stressful. It's like, well, I'm not going to stop doing my job. But we had a car crash with 4 people. So 2 went to Casper, 1 flew away. We brought ours here. Well, I'm not driving because I'm having a heart attack, my ambulance. So I rode with my patient in the back having a heart attack the whole time because I can't drive. And then I dropped off my patient, gave him a report. They put me on a 12 lead. I was having a big STEMI. got back in the bus and they drove me to Casper. I was like, and Cher went same day. Cher was having a heart attack on the same day and she wasn't on my call, but she went at the same time I did. So we were kind of like roommates that day. It's like, well, this is bad. Half the ambulance crew's in the cath lab today.
I should expect a heart attack.
Yeah, well, I hope not. I hope not. But
Already
it was,
thought, what? Yeah, so I'm already on that.
yeah, it was 10 years ago in April.
70,000 or 700,000 today?
700,000.
I have
700,000.
high cholesterol, hypertension, tachycardia, so basically. what I'm
15% don't survive. Do you know? Let me look at your book, but let's look.
hearing. Yeah.
Look at your book.
My family. Oh,
So in Salt Lake, if you guys have ever been to Salt Lake Gold Star down there, they have AEDs on every place they can put them, and their percentage of survival in Salt Lake, if somebody has a heart attack, is 98%. They train, they have their fire department helps train lay people. They have AEDs placed everywhere in every government building, in every school, everywhere that can be placed. They got grants. Their survival rate is 98% in Salt Lake. They are the Gold Star city for that. Our town has one in each school here, one in the college, some in the hospital, like down in the lobby down there. They will not allow me to put one in Safeway. They don't want anything to do with that. And I've ran 7 calls there for cardiac arrest in Safeway. Some of them were their own employees. And they won't let me because they don't want to be responsible for training their people to know how to run it. I said, it's for everybody. It's for the layperson to grab it and put it on, but they don't want that responsibility. And there's not one in any place downtown here. There's not one in the in the post office. I mean, they're waiting on us. So if we're at the bridge, like now, you got 15 minutes, you better know how to do CPR because
You're better off running to the hospital.
Literally.
yeah, that's what I'm saying. You know, if our town, if we could get with everybody and get this town to be a Gold Star town like Salt Lake is, that would be awesome. We wouldn't lose as many people.
Yeah.
I've tried, Sharon, we've been to everybody. We've done all the school stuff. We've done.
As many senior patients as I see every day. Therapy, I'm surprised at the closest AED.
Mhm.
Go all the way through the clinic.
Right.
Outdoor.
Right. Yeah, which, you know, if it could be fixed, if it was their person. I mean, we had a heart attack of a 17-year-old running out the golf course and cross country. I mean, it's not going to be the old person. It's not going to be, it could be anybody. You know, if they'd have had an AED out there, you know, we maybe could have saved it. There isn't. And I wish there was. I mean, if we could teach these people that it's not a big responsibility, it's easy. It tells you what to do. Put pads on. Tells you shock or not shock. It's not scary. Grab it.
You have pictures.
I was gonna say, it's got pictures.
But we need to teach them that.
Yeah.
That it's not scary.
Yeah.
That it's not a bad thing.
Yeah.
You're not going to hurt anybody. If it doesn't say shock, don't shock them.
Yeah.
It tells you what to do. They don't want that responsibility. So
Not even at like the truck stop or anything?
no, not the truck stop. The schools, I'll have
I feel
them.
like the truck stop would be a good place to have.
The
those
school
The rec
and
center
all
has
the
it.
athletic facilities, yeah.
Oh, they all have
All the
them.
soccer fields, everything there.
Yep. Yep.
Yeah, I guess it's probably not one in the trailer, then, would be the closest one to the football field, right? Unless they have one
Yeah,
tucked
but they
underneath
always
the
have,
stands.
they always have.
Their trainer, if it's at the football field, they always have. Yeah.
Okay.
Yeah.
Well, and usually-
Yeah.
Usually, but
Yeah.
not always. Right. Right. Okay. Here we go. 1 to 6. Everybody ready? We got to get through all this stuff. Acute myocardial infarction is what? Did we already talk about? What happens when you're having an MI?
It's, the
Hmm? Your arteries in your blood vessels of your heart are occluded, correct? Right? All right. Find that in here. There we are. There we are. I'm gonna find them. Right here. Look at these guys right here. Can you see?
Yep.
these guys, somewhere in there, there's an occlusion. Somewhere in there. When you get better and when you learn to read 12 leads, you'll know when you look at this where the occlusion is. Is it top? Is it bottom? Is it right? Is it left? I can look at this and tell you exactly where in the heart we're having a problem. I can tell you right now that if they're having a heart attack in this spot, what's going to happen next? Is their blood pressure going to drop? Is their pulse going to drop? I mean, I'm ready. I'm ahead of that. So I know when I look at my 12 lead, oh crap, let's go. Or this is what's going to happen next. Are we going to have different beats? So, but yes, that's what a STEMI is, or an MI. Somewhere in there, there's a blood clot. We have how long to get to Casper or to a cath lab, depending on where you're, huh? 90 minutes. We made it in 60, but 90 minutes to get that open.
Is 90 minutes
It's the gold
for
standard.
life?
Huh?
Is that for life or what's 90
If
minutes?
you get that clot busted up with the cardiac cath, which goes through here into there, you will not have tissue damage.
Okay, that's
You're
what
not
I
going
was
to kill the heart. You may save your patient, but if you're over 90 minutes, 2 hours, 3 hours, that heart's not going to come back. I mean, that part of the heart is not going to come back. That's where Carlos is at. That little part of the heart is dead. You may still be living, but you can't reperfuse that. Once it's dead, it's dead. And I don't mean the whole heart at times, but that little piece that you didn't fix is not, you can't get it back.
I just didn't know what the 98, because don't they
Yeah.
say, is it time is tissue or
Time is
muscle?
tissue, time is muscle. Yeah, let's go. Let's get this opened up to save this patient's heart. Time is tissue. You are correct.
It's not quite the golden hour.
Well, no. The more you hurry, the better for your patient.
Yeah.
Because I went from the wreck running up and down the hill to Douglas, back to Casper,
Yeah.
and I'm still here. Okay, what's a thrombus? That's what Carlos had, a clot. A thrombus is a clot, and I don't know if that's going to be on your test, but a thrombus is a clot. Do any of you guys? Thrombus is a clot. Have any of you guys ever seen a blood clot? I'm gross. It's not long and stringy. Yes. Yeah. Yeah. And when Carlos's came out, it was like, it was cool.
You saw it?
I stayed.
Yeah.
He's my partner. He's my buddy. I stopped. I watched. I sat in the little, you can sit in the little room and watch their little video. I can't be in the room with him, but I can see him through the window. And I sat and watched. And you could see when heart would beat and he would take a breath, it would go, and then it'd relax. And he'd get a little bit of blood through there, enough to perfuse, and then it would go back in and shut it off completely.
So if you make the hospital in 60 minutes, like Casper, they're usually not a hard time getting in and getting the sucker in and taken out. And that's
If we're in the ambulance, they already know we're coming. I've already sent the 12 lead there. Then they send it on my 12 lead to them. They already have it. They know exactly what part of the heart they're going to work on. They're already in the cath lab. We go from the ambulance up to the cath lab. The patient's already naked. The patient already has IVs. You just flip them over there and they stick that sucker in. I mean, it don't take no time at all. Yeah, we do all that stuff ahead of time. This is the meds they're on. This is the meds we've given. Here's your IV. We're out the door. I mean, we don't dink around in there for maybe 2 minutes, maybe. Moving our patients over, moving all the IVs over and get out the door. And they're working. It's fun. All right. So there's your death, the area of the infarct right there. Okay. Huh? Yeah, you can look at this thing if you want to. Here. Yeah. Yeah. Yeah, you guys can all look at this if you want to. And I have this other one here. Here's this one too. It's a smaller version of, but you guys can all look at it if you want.
Yeah, I was like, I can just go copy this.
Yeah, you can copy it if you want to. They're so handy.
Yeah, exactly. Memorize.
The best you've got.
Hmm?
That one on the car look like if it was upside down? Yeah, I was walking through the parking lot today and one of the nurses had like a thing on their car, but the sinus rhythm was upside down.
It's matched up.
Yeah,
Yeah,
Yeah, but it looked like this septal one here.
yeah, yep.
I was like, I was there looking at it, I stopped for a second, like,
What's,
doesn't look right.
what's wrong with this picture?
second.
Wait a second. All right, so we'll go through, it's not on your test, I'm just showing you. The inferior, what does inferior mean to you?
Lower.
Hmm? Lower, so where's lower? Where on this dude? Right here, see, I know it's small, I'm sorry. Inferior, what is the inferior part of your heart?
The ventricles.
Correct. So if we're having a STEMI or an MI in 2, 3, or AVF, and we're going to hook up the 12 lead here in like 5 minutes. 2, 3, or AVF, I'll show you.
Yeah, I'm also
Yep, no, I'm back to you. We're having a STEMI in 2, 3, or AVF. See these little things right there?
Okay.
That is your left ventricle. If we're having a STEMI in your left ventricle, do you think I'm going to panic? Well, not out to my patient, but
on the inside.
because your left ventricle is having a big MI and it's not getting any blood.
And 3 is.
2, 3, and AVF is your left ventricle. That's where in the heart, this 12 lead shows you, and I can see it in my head, that is your left ventricle. 2, 3, and AVF is always your left ventricle in your 12 lead. So if we're having a STEMI in that, your left ventricle is not getting blood. Let's go to Casper. What if I give nitro to that patient?
They're gonna tank
Yeah, why?
because they're not getting any blood to the rest of their body.
Yeah, they're already compromised because they're having a STEMI in their left ventricle, and then we just gave them nitro, which opened up everything.
But there's nothing.
But there's nothing
to
to
go.
pump it back because your left ventricle is dying.
So,
Holy crap.
so if we give them nitro on scene.
Yeah,
we-
that's why you guys need to be looking at this stuff. And I know you don't need to know it all, but be ready, get them flat. Be ready. If you put the 12 lead on and you see something like that on your 2, 3, and AVF, wait on your nitro. If you can, till you get a line.
Before we even got hooked up, we would be able to see the low blood pressure.
Right, correct.
So
And we
that-
wouldn't
that'll
be
the
given
contract
nitro.
we use.
We wouldn't be given nitro. Pale, cold, diaphoretic, low blood pressure because their left ventricle is not working. Yep, low blood pressure. No nitro. Even if it's their nitro. No.
Sorry, no.
Sorry, no. But we can give aspirin. We can still give aspirin. All right, so the next one I'm going to look at is the purple ones, which is the septal. Where's septal? Where's the septum in your heart? In your heart.
Top?
The middle.
Oh, middle.
Okay, so look at your RCAT. Hang on, I'll grab the RCAT right here. Look at your RCAT right here. Right here's your septum, correct? Correct? That's the middle part of your heart. Separates the left from the right, correct? What if we're having a STEMI right here?
That would restrict refill.
Electricity.
Oh.
Your heart, you're gonna get that back because this part that has the electricity running through it is dying. Is not, your electricity is not going through. Is that making sense?
I'm still.
What's the matter? Tell me.
Oh no, it's not really a problem. It's when you say STEMI, my brain is still telling me.
Am I?
Swelling, not blockage.
I'm sorry.
No,
I'm sorry.
you're fine. That's why I said it was a lack of refill because I was thinking it was.
Yeah, I understand.
Yeah.
Okay. Yeah, but if you kind of know, so you got your inferior is this, right?
Yep.
Your septal is this. So that's your purple ones. Your septum. Okay, so then we do anterior. Where's anterior? Huh?
Front.
Up front top. What is that? What's the anterior part of your heart? Huh? Your atrium. Okay, so be ready for no P wave. Be ready for widening QRS. Why is your QRS getting wider? Or the big bump? Because there's no electricity going down to your ventricles because you're killing this SA node. That make sense?
Yep.
So in your head, you're thinking, oh, because this is gonna happen next because this is not working there and this is not working there. Okay, and then your next one is all the red ones are your lateral. Where's lateral?
Left side.
Lateral outside, right?
Wouldn't it technically be just the left side?
But
since-
if you got left side, right side.
Oh, okay, I got
So
you.
you're all lateral, depending on where the lateral is.
Say it again, left side, left side.
Left side, lateral,
Yep.
or the outside of the heart. Right side, lateral, right side of the heart. Left side, right side. Lateral, still on the outside, but the left outside, the right
So
outside.
on every trip that you read, your right
Both
side will be on
sides
this side,
Mhm.
your left side.
Mhm, mhm.
Okay, and this is how we hook up the.
Yeah,
12
yeah,
leads.
okay, we're gonna do that now, so you guys know. Let's do that now. Let's hook up some 12 leads. Who wants to be my volunteer? Or do we have a mannequin? I don't know if we have a mannequin or what.
No, these ones don't come back. Oh, these ones come back.
I just chugged a monster.
Awesome. What's your heart rate?
I've got insanely low blood pressure all the
I'll
time. So,
I'm trying to get these all entangled.
so, question here.
Okay, go
It
ahead.
is
So,
104.
104. I don't know, can I hook this to that? Because I don't know what I can and cannot use.
you can hook her up to me if you like. I was gonna say, I don't know how to turn on some man,
I don't
so
either.
I don't know if we get anything.
Yeah, I don't know.
You're more than welcome.
105, 94.
Well, right now, we're just gonna hook them up. What? What?
I don't know. Pulse oxes always make me feel bad about myself. But I'm always
This one would go up and this one would go
Okay,
down, right?
right. at the
Okay.
right.
Am I correct?
let's not do this yet. Let's do this. Okay.
Even when I'm not.
So-
feeling it.
First thing we're gonna do is what with our patient?
Lay him supine.
Lay them in a position of comfort.
Or where they can be. yeah.
Okay, so this, every one of yours has this on it, right arm. Okay? Every one of them has it left arm.
Oh,
Okay?
Smoke on fire, scout on the grass.
Yep. Left leg, right leg. Okay? You're getting the back of the bus, you're going right, left. This is left. Okay. So who wants to go? Who wants to go? Anybody?
I think, I was gonna say, I think we should do Ian.
Yeah.
You got that
His
monster
monster, yeah.
cooking through your veins right now.
All right. Who wants to play?
Can I peel him off of him too?
Hmm, I don't know if you know him that well. That might hurt.
That was the point.
He stabbed it like 3 times with
Yeah,
the
he
glucose.
was trying to take my blood pressure or my blood
glucose.
sugar. And it was not well.
Ouch.
He had to do it a couple of times.
Can I pull these up first?
Yes, please do. Because it hurts when you push them on your chest.
Oh, well, in that case,
You got the little grandmas. Please don't do that to them.
just the little Ians.
And little kids either. Okay, have a seat.
This one hand width over.
Huh? Have a sit. Bring your wheelchair over here.
That'd have been a lot less funny about a year and a half ago.
I've untangled these before I put the sticky pad.
Did you had a wheelchair?
He broke
about
both of his
3
heels.
months.
Ouch. Dang it, dude.
Bro was on the fire department for like,
2
how
weeks.
long? Yeah, 2 weeks.
2 weeks.
Alright.
Not even 2 weeks,
There
actually.
you
It was like
go.
10 days.
Ouchie. How'd you do that?
I got knocked off ladder working on day 5.
Oh, man. Did I come get you?
He
No.
left off to the wrong lady. You
No,
trying to help?
I sat on the
I'll help
ground
you.
for about
Take your
30
right
minutes, then Wes decided to load me
Yeah,
in the
that's
brush
okay.
truck to drive me over.
Oh, I did.
This
I
is
was
how
there
this
that
is how they
day.
told me to
Oh,
remember.
well then yes.
Yes.
Sky is white,
Sky over grass,
grass,
smoke,
yep.
fire.
Okay,
That's a Jim Brown original for me.
Yeah.
that's fine. As
But,
long as you
okay,
remember it, I'm
so
happy.
when Jim did this on me, he put them on my wrists and my ankles.
You can do that. I put them, because I'm gonna do a 12 lead, I'm gonna put them here, 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 and here, because I'm gonna do a 12 lead.
Okay.
And this cord is not really long.
Got it.
So we kind
Sure,
of can't
Rita.
have them down there if I'm gonna do a 12
No,
lead.
that makes sense.
Here, let's scoot you over a little bit more.
Can you come closer to my machine?
I'm
Here.
working on it.
Thanks.
Grandma,
I'm gonna come right.
yeah, Grandma, would you get closer?
Okay, so
This would, no, we're in bus, so right side is this side. That's why.
we've got the rights. I got the left.
Okay, left,
I got the
So
right
this
side.
one would go
left
lower,
leg. Yep,
right?
left leg. Right.
That's the fire.
like here.
Yes, yes,
Sorry,
Okay.
my hands are so cold.
yes. This is your
I-
patient. Tell your grandma.
welcome it.
Can you see?
Yeah, I'm in one.
Okay.
And then here,
Mm-hmm. Yep.
fun
We need to
Right here. Is
dot
good?
these.
on it.
Yes.
There you go. Want to do one, Danny?
No, you got it.
She's
Your
gonna
hand
do a
already.
12 lead.
First, just don't know it yet.
And I'll show you a trick to do the 12 lead easier, to get the dots
Okay.
on correctly. I went to school in Texas. I have to learn redneck. This is the way I learn. and This is the way I teach. That's just toilet paper my ass is what I learned.
Okay, dotted.
Dotted. Okay, we are dotted. We're not gonna hook this up until we're ready. It's not gonna shock you, Grandma. It's okay. So we're gonna do V1 first.
Sorry, short cord.
Got a
Short,
Short
cord.
cord, that's the problem.
Okay.
Yep. Okay, let me see your chest, Mr. Ian. Okay, so where do we have this guy? Right here? Yes?
Mhm.
So we're gonna go right here and right here, okay? Because that's there. So we're gonna go right, see, feel this? And we don't want to go on the bone part, so we gotta
Okay.
scooch
Oh,
right
scoot
there,
over.
right
Okay.
there.
I see.
There's one,
Okay.
and we need two, just the opposite, same spot.
It's so exposed.
I'm really
Sorry.
glad you did this, actually. I take it back.
Sorry, Ian.
Spring break.
Thanks. Right here.
Yeah, feel where the bone is, and then not on the bone. Yep, right.
V1,
Opposite of that one.
V2.
V2. Okay, so now we've got V1, V2. We've got all our limb leads. Straight down here, we're going to put 4.
4.
Because 3 is going to be in the middle of them. So put 4 right here. Okay. And this is the way, if you do it this way every time, you won't mess it up. Oh,
This is
phone.
also how I count. 1, 2, 4.
It's a little messed up.
It'll make sense to Ian.
I'm a
So
little
nipple
messed up.
line right there. Okay.
Mhm.
Then we're going to do 6 mid-axillary.
Oh, yeah. I do remember seeing that.
Yep. and
It's
6
the
is
armpit
mid
line.
Yeah, it's what
armpit
splits.
line. So do
Mhm.
6.
What? Oh my God.
And if you have a grandma, don't be doing this. Be doing this, please. And the smart asses in Texas, they said put the dots nipple line, and grandma was laying this way because she had, and they put it there.
Interesting.
Yes, yeah,
Right there.
yep. Okay, so then we're going to put 3 in the middle of 2 and 4 here, not on the bone, though, so make sure.
I don't think I have enough hair on my chest to.
I hope it rips it off.
So we're going to put it in the middle here,
Perfect.
and then 4 or 6 or 5 is going to be there. Does that help? Does that help to get
Make
those?
sure you get
So
it
then you
right
get
on
your
the hair.
landmarks.
That makes sense.
Okay. Yeah, if you try to do 1, 2, 3, 4, then everything kind of bunches up and it's hard
Yeah.
to.
And then right in
Yep,
the middle.
right in the middle. Yes. So it makes it like a circle, like
Mhm.
that.
Okay, spring
Okay.
break's over.
Spring break's over. Okay, now we got to make sure we hook this up. Short cord. Got to hook that to that. Okay, so when we turn this on, what do we say about lead 2? What did I say over there about lead 2? What does lead 2 look at? If you got to look at your thing, look at your thing. It's right there. What does lead 2 look at? Okay, inferior.
Oh,
2, 3 and AVF is inferior.
Oh, yeah, yeah.
So every
Here,
time
lower
we
top.
turn the monitor on, right here's lead 2, see that?
Uh-huh.
Where am I looking when I turn the
The
monitor?
lower part of the heart.
Right, the ventricle. Every time I turn it on, I'm looking at the ventricle.
Okay.
My phone just keeps going off. Nobody wants me any other time.
Except for right
Okay,
now.
so right now we're looking lead 2 at the ventricle. That's what we're looking at. What do we have? Do we have a P wave?
Yep.
Do we have a QRS? Goes blip, blip,
Yep.
up like it's supposed to? What's our rate?
Yeah.
How are we
Yeah.
doing? Do we have a pulse? Anybody check his pulse? Are we pale, cool, diaphoretic, anything?
I can't find it.
He's dead.
Oh, Lord.
I know it's there.
So if there is no pulse, what is that?
Huh?
EEA. Remember pulseless
Oh,
electrical
yes, yes,
activation?
yes.
Yeah. Got a pulse?
Yep.
Okay, cool. So that is the inferior part of the heart. Every time you look at lead 2 now, you're going to be thinking the bottom part of the heart. It's like, oh, okay. I know that's working. I got a ventricle.
Good.
Bonus. I have an SA node. Bonus, because I got a P wave.
Yep.
Yay. Okay, let's look at our 12 lead. Here we go. See what we got. Oh my goodness, oh my goodness. And then I'm going to capture it. Don't move, Mr. Ian. As we're bouncing down the highway in the dirt road.
Yeah.
We're telling Wes to stop, and he said, we're not stopping.
You said let him go, so I'm going.
I'm going. It's acquiring. We're saving, and then I'll show you on here. Are you, one of you guys going to be working with the ambulance, or do you know? Anybody going to be working here?
I won't.
Okay, so see this little envelope? 1, 2, 3, the little envelope? You push that, and you push the dot, and then you can, I won't, but you can transmit this to here or
So
WMC,
cool.
and it will go there to the doc, and they will have this same copy as I have now. So,
That is.
yeah, I won't do that now, but they will have this.
I know that. This thing has- yeah, this thing has like
Yeah.
JJ, are you guys busy?
All right. I want you to look, everybody look. Everybody can look?
Yep.
All right. So we're looking first. What were we looking at? 2, 3, and AVF, correct?
Yep.
That's where we always look first on a 12 lead. I hope not.
Always.
But we don't have shocks on, so we're okay, right? UA, QRS, no funky funkiness. Then where are we gonna go? We're gonna go over here, right? It's gonna be negative because we're looking at a different part of the heart, because this looks at 12 pieces of the heart. So it's gonna be negative, and that's okay, because it's looking from the bottom up. So V1, V2, we still have P wave, QRS. Everything looks okay. I don't see any STEMIs. Then we go 3 and 4. Nothing. 5 and 6 are your laterals. And
3 and 4, or was the
3 and 4,
interiors?
we got inferior, these.
Yeah,
Interior, yes. And lateral. Looks good, Ian. I think you're going to survive. I see
Dang it.
nothing. I see like you're okay. Does that help you guys at all to
Ordered it,
kind of
yeah.
know?
Yes.
Yes.
Kind of know that, but every time you turn this on, you're looking at lead 2. Usually that's where it's set up. Most monitors are set up to lead 2.
Lead 2.
Lead 2,
Feel it.
ventricle,
Here,
ventricle.
We're pumping.
We got a PUA QRS and it's regular rhythm. I'm
Pumping.
happy camper.
Yeah.
If it looks like that, not happy camper.
Scared
Trying to
camper.
bump, it's trying to
Scared
bump,
camper.
but it's
Hey,
hell of a
Yeah,
bump.
yeah. Can I get a helicopter, please? Please.
Okay.
They can't fly.
Well,
Well, yeah. Okay.
How do you expect me to drive? They can't fly.
Yeah.
It's slicker up here or down here than it is in the air.
Yeah. We had one patient that his brain was trying to perfuse. And every time you would do CPR, and we did excellent CPR, he would reach up and grab my hand. So his brain is perfusing, but
Yeah.
his heart is not. So we're pumping his heart. But every time I would stop, it would be a systole.
oh man.
CPR. And he would fought us all the way to town, all the way to town. We had to have fire guys hold his hand. And we're trying to do CPR on a guy that's fighting us. This is ridiculous. But every time he would stop, there was nothing. They could,
Soft restraint.
yeah.
So
Good about us.
when his brain, when he was getting perfusion in his brain,
Yeah.
it was telling him that someone's like,
Fight or flight, fight
Yeah.
or flight. I'm scared to death. What the hell's happening? But once you stopped doing that,
Yeah, 'cause
absolutely
you were
nothing.
pumping the heart for him.
I was doing it.
I'm
Yes.
curious what this tells me my oxygen level is, because this is telling me that my heart rate is like 20 beats per
Yeah.
minute lower than my pulse ox did.
Let's see.
So maybe your pulse ox is broken.
I hope not, because I just bought it.
99 heart rate, 95. 88. We're good.
Well, at least the oxygen's close.
Yep.
What did yours say?
94.
Yeah. You're good. You're still alive. All right. Any questions with that, guys? Anything I can help you with this at all?
Y'all gonna have to rock, paper, scissors for the rips. this off.
I'm not ripping.
Casey will gladly rip.
I won.
No
All right.
contest.
All right, no questions? You can have this, Ian, if you want it for your practice. Okay. Well, you all got my number right if you need me, but we're not done. But if you need me, I will be happy to help you with anything. Like I said, Cher calls me on calls. It's like, what is this? And she sends me pictures. Okay, calm down.
Here is what it is.
Here's what it is.
Take some deep breaths.
Your heart is faster than your patience. You're okay.
I didn't like that.
Right.
I think it was your hands being wet, not. Oh, oh. Probably.
Yes.
I get at least one more.
I was about to go all of them. Oh. You want me to go full spring break?
Not as fun. You don't.
I was hoping you just strip me yourself.
Or not that one. Don't.
Okay. All right. Where are we at, guys? How are we doing? Ripping leads off. You guys getting bored? Am I boring y'all?
Nope.
Okay. Yeah. Yep.
It will come up.
Ow, 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 ow.
This is the best payback I think I've ever gotten.
For what?
For stabbing her like 6 times to get.
She stabbed me like
No, I stabbed you like once. Don't even.
twice.
And I think I think I stabbed Glenn too.
Yeah.
You also threw Glenn in the KED.
I know, but I let him tip me upside down.
That was a fair trade.
We were,
I
yeah,
will-
we were
I
even
will.
on that.
That was a good
You were-
trade.
You were strapped to the backboard. You weren't
I was
letting us do anything.
Young when I started this little tiny, like maybe 80 pounds. They put me on the backboard with duct tape because this was 30 plus years ago, and then put me on the wall.
I told him that.
For the
I was
rest of the
gonna-
class, I was on the wall.
I told him that I was gonna wax his eyebrows if he put tape on my head.
Yeah, nope. They taped me to the backboard, and I the rest of my class, I listened because I could not
You were on
get.
the wall.
I was on the wall.
I'd kill you
This
guys.
is, this is
We had-
really, this is really.
We had
good.
one guy
Huh?
on our
Oh,
mine
it shows
rescue
you.
team.
Yes,
Shows
where
you
it's
what
looking on your
Yeah.
lateral. Yes, looking here, looking there on this side of the heart. Yes, I love these things.
Septal,
Yep.
right?
Mhm, yep. Mhm.
And then we put him on
Yeah.
nasal cannula. so
Yeah,
he
those are-
Interior.
and cover his mouth.
Yep,
Yeah,
those are
just suck him in the
fascinating to
corner on
me.
the back.
Yeah, yeah.
Yep.
This is really, really helpful because I've helped, in the back of the bus,
Mhm.
on phone calls, I've helped a lot with 12 leads on, but
Yep.
I didn't really know what I was looking at.
Sure.
This-
And now you're gonna look when you're on there.
Now,
Now it's
yeah.
like, oh, okay. Oh, now I know why they say, oh crap, here we go. It's like, you put them on your first one and you're seeing the inferior and you've got, where'd my thing go for STEMI? Let's look here. Where'd my big one go? Here. You got your lead 2. That's all I've got because you cannot diagnose a STEMI with 1 lead. Lead 2 does not diagnose. You have to have a 12 lead. Because it has to be a STEMI in 3 contiguous leads, 2, 3 AVF. But it cannot be in 1. Okay. All right. So we put them on the monitor. It looks like this. Does this look like your regular sinus rhythm?
No.
No. This is an ST. That's your T wave. Elevation. STEMI. STEMI. ST. It does not go back down to baseline. STEMI. It looks like a fireman's hat. It's going to be a tombstone here in a minute if we don't get moving.
Mhm.
Okay, because it's going to be clear up here and look just like a tombstone. That's what a STEMI is. So you put them on lead 2 and you come up with this as soon as you start it, we're out the door. Aspirin, nitro, lines, let's go. So that's a STEMI. ST elevation, ST elevation, MI. But it has to be in more than 1 lead. It can't be in lead 2. So we got to get a 12 lead every time.
I have a slight question about this.
What?
Did you plug in my age or did you just assume my age?
I did not plug in your age.
That was probably.
It's the set
very
age.
over- yeah.
It's just the set age.
Making me feel old.
I did not plug in your age.
You say from a heart attack. All right.
All right, how you guys doing? Are y'all brains going?
Much better now that I've looked and I have a normal.
Okay,
For a 40-plus-year-old male.
well, that's good.
It's going really well
I'm not even 30 yet.
until when we have to take a test on this.
Yes.
And then it's not.
Well, is there something I could be doing different or telling
No.
different or
No,
not
no,
going
no,
up
no.
here?
We can run through everything, kill every question you hand us until you put it on a test. and then
Yeah,
we're
once it's
gonna
on
do
paper in front of us, we
your-
fumble.
Okay, well,
Yeah.
if there's something I can help you with or extra papers
No,
or
and I like
anything.
that you're going a little bit more in depth too, because I'm a why person, so knowing why these things are happening is gonna help me understand the basics more.
My friend just got engaged. Sorry, hang on.
I love that.
Me too, and I'm not with her. And he's in trouble. She's supposed to wait for me. Okay. All right, ischemia. What is ischemia?
Back question.
They're in Nebraska.
Are you from Nebraska?
Huh? No, my friend is in Nebraska.
Glenn got excited. We thought he meant it.
Okay, what's a dysrhythmia? What does that mean to you? Dysrhythmia.
There's something off with the rhythm.
Yeah.
Abnormal rhythm.
Okay, so what? And I don't want to go into craziness for you guys because I don't want you to think, Lord help me, what has she done to me now? I'm looking, hold on. I'm looking. Do you guys ever want to take a 12 lead class when you get done with this other class? You just call me. Because I teach a pretty good 12 lead class. All right, so the low grandmas that have a history of AFib, heard of AFib before? This is what AFib looks like on your monitor. It will never be regular. AFib is never, ever, ever regular. So your QRSs, these little things, are not going to be, see, they're not the same
So they're
distance.
not equal distance.
So when you reach down and check a pulse on somebody with AFib, it's not going to be regular. It's not. You're going to, and she'll tell you, I have a history of AFib, and you'll, okay, and then you'll see this. And there's no P waves in there because what is AFib? Not VFib, but AFib. Atrial fibrillation. The top, both atria are doing this. Both of them. Ventricles are working as best they can. And people live with AFib all the time. And they will be on blood thinners. Why? AFib people generally are on blood thinners. What's your atria doing? It is, but is it pumping? Is it actually pushing the blood? No. Yeah, it's twitching all the time, both sides. Your ventricle's doing all the work, but your atria, so what happens to this blood that's up here? It's going to clot. So they're going to be on blood thinners so that it doesn't clot. Okay? So if you reach down, grab a pulse, and you see this on the monitor where it's kind of jaggedy there, but not regular here, that's AFib. And that's an irregular or a dysrhythmia. Okay? That's normal for that patient. But know that she's probably on blood thinners of some sort. Or he, or whoever. Does that make sense? AFib. Not VFib. VFib, be shocked. Be shocked, VFib, or be dead. All right. MI can cause mechanical problems with the heart. Cardiogenic shock. Shock. What is shock?
Lack of perfusion.
Right. Sudden death. Who's going to be more suddenly death? The older Carloses or the younger ones? The younger ones. Okay. What do they normally feel like? What? Tell me about an MI. Huh? Like they're dying? Got that? Yeah, got that elephant on their chest? Yes. Sick or not sick, you walk in and you can tell there's something not right here. This is not a joke and somebody is just telling you I've got heartburn. Something's not right. So that's what we said. If you're in town or that side of town, we're going to stop at the hospital because they're going to give the nitro drip that we have to take as a paramedic. They're not going to do the balloon here. They'll do that in Casper. Okay. And then aspirin probably and beta blockers. And then we're out the door. Well, that was fun.
You got chalky milk and didn't bring any for the rest of the class?
There's enough for everybody to have
That's
sex.
also such a cute little thing in front of you.
I can't believe he didn't wait for me. Nah, he's in trouble. Dang it. Okay, sorry. Back to me. Do your primary, secondary assessment. Believe your patient when they say they're going to die. Okay, we've done the 12 lead. We called ALS. They're not here, they're at the bridge. And be prepared for cardiac arrest. So if we're going to be prepared for cardiac arrest, what does that mean to you guys? We're preparing. We are, you know, when you were young and you look for an adult, guess what? Now you guys are the adults. You're looking around like, oh crap, it's me. It's me.
You're an adult. I need
Yes.
an adult or adult.
Get the AED on. Get those patches on. The big patches on.
Get them on.
Get them on. Get them on. If you think we're having a STEMI, get them on. It's not going to be wrong. We got to take them off. We got to take them off. But be ready. Get them on. Be ready. Okay. Aspirin. What is our stuff for aspirin? Tell me about aspirin.
4 tablets, 164 milligrams to 320.
Okay. And what do we check first?
Blood thinners.
Okay.
GI bleed.
Okay.
Allergies.
Allergies.
I could not get that.
Allergies. Yes. What about nitro? Can we just give them nitro out of the bag? You guys? No. So they are on nitro. They have nitro. It's prescribed. Okay. So what do we want to know about nitro before we give it?
They took one a little while ago.
Okay. What else? Okay. What hypotensive? Well, how low? Below 100. If they're at 80, don't give them nitro. If you put them on that and your lead 2 shows fireman stats, are we going to give nitro? Be ready, because if you don't got a line and you give nitro, you aren't getting them back. Everything's already, and now the rest of it. Okay. Heart failure, CHF. There are people that live with CHF all the time. Heart is unable to pump. My aunt had CHF. What kind of meds might they be on for CHF? Do you guys know?
I don't know.
Meds, they're going to be, remember that grandma that's on a water pill? They're going to be on a water pill because what is CHF? Congestive heart failure. Congestive fluid, which is in the lungs because your heart's not pumping properly. So they're going to be on that water pill that keeps everything moving and not backing up. And so if they're on a water pill that makes them pee, they're going to be on a potassium pill because they peed off all their potassium. But then the grandma's broke, so she only takes her potassium and doesn't take the water pill, or only takes the water pill and doesn't take her potassium pill. So ask, did you take these? Have you taken these? You know, when was the last time you took these? This kind of gives you an idea. If she's taking too much potassium. Okay. And once you hear a congestive heart failure lungs, you'll never not know what it is again. Yes, sir.
Isn't too much potassium another contraindication?
Huh? No, not too much potassium. No, because we won't know that until we get a lab work. But if we're looking at the monitor and they've got a sine wave or a no QRS, no P wave, they've had too much potassium. But we won't know that because we can't run blood in the back of the bus.
Oh, that's for.
Yeah. Yeah, we can't know that other than we can look at the monitor and maybe tell, but. Okay, right-sided heart failure. What does the right side of the heart do? Right side is the rest of the body.
Body.
Your feet.
Left side's the lungs.
Left side's the lungs, right is your feet. So if your feet are swollen, you got elephant feet. That's right-sided heart failure. Sometimes the failure goes clear up into here. I mean, it swells clear up to there. Okay. What is JVD? Pitting edema? Yes, you will see that. What is JVD? What is that? Okay, can you look from here to tell? How do you tell? You got to get them to turn and look. Okay. So don't document that if you don't look at it.
Sorry, that's what?
Don't document that if you don't look at that. You got to get them to turn to see if you've got JVD. If you've got so much fluid backing up that your jugular vein are backing up into your head, we got a lot of fluid we need to get off. Okay, but we're not going to do it, but we need to let that hospital now. Okay, fetal edema, swelling in the feet. Okay, left-sided heart failure, what does that do? In the lungs, and then what do your lungs sound like? Sounds like what?
Building up the fluid.
Fluid, so bubbles in milk. Bubbles in milk, yes, can be life-threatening. Why is left worse than right?
Because that's where your blood supply is coming from into your heart.
Yeah, and it can't go anywhere.
Okay.
Yeah. Yeah, your left ventricle is not working.
When
Yep.
it does pump, you're not getting that volume.
Yep, and you're not getting the push. Nope, correct. Okay. Do your assessment always, 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 always. Okay. Coughing up pink frothy sputum. That's the one I told you guys about last time with the grandma that took the daughter that gave her all of those once of her nitro pills. We had pink frothy sputum coming out her nose everywhere, and we ain't gonna get grandma back. Grandma's done. Were you guys all here when we did that, when I told you that one? It was bad, and she died, and it was terrible. Okay. Oh, what's OPQRST?
Complication, quality, radiation.
Severity.
and
Very
time.
dumb.
Okay, what about sample?
Sometimes allergies.
Medications, capacity, fast oral intake. gasoline intake.
Okay, all right,
Good job, good. I'm so
good
proud of you.
job.
I'm so proud of myself.
All right. You contact ALS. Hopefully they're coming. You give nitro, their nitro, not your nitro. Uh-oh, what's an aneurysm?
Blowout of the artery.
Artery. So it can be your aorta. It can be your pulmonary, coming from the feet up. You'll feel a pulsating mass here. Could, possibly. Okay. You check pulses. Check one. We got one. Check this one. There's not one. Or they're not the same. So if you look like somebody's doing that, be ready for them to code, and you're not going to fix them. I'm sorry to say, but if it bursts, you're done. We had one burst at Orange Junction, and you ain't going to get him back. The more we did CPR, the bigger his belly got. We were just pumping into his belly and went. So, yeah, we're not going to fix that here. That's what that is. Any questions? Okay.
All right now, tell me about.
All right, do you guys know about resuscitation? You need to take a break. Do we know about this already? Have you all got your CPR card? Okay, so you guys have already done resuscitation, yes?
Yeah.
So do we need to go through it? Are you guys, you read the thing and you understand how to put the pads and patches on, how to, you good?
Yeah, yeah.
Okay, so I just want to make sure. I don't want to, if we don't have to go through it, but I don't want you to not get it right on the test. 2-minute rounds, check a pulse.
Check pulse.
100 to 120 beats.
Okay.
Press,
Okay,
do
All right.
rounds,
okay,
do
all right,
detailing days, hook up.
okay, all right.
Don't
Talk-
say call 911 because you are 911.
Don't look
Call
around for an
ALS.
adult or an adult or adult because you're it. Somebody help me. Oh God, this is me.
Bummer.
Very first one as a paramedic, I'm like, oh, it's me. I got to remember all these meds. We're good. We're good. So, is there anything I need to go over with you? Make sure a pediatric, how do you put the patches on for a pediatric? Front and back. Okay.
Which takes on me.
Yeah, I just want to make sure that there's something on the test that I don't want to miss it, okay? What about somebody that has a port or a pacemaker? Don't put it over that. What about jewelry? Take this necklace off, take it out. Probably shouldn't have to remove the belly ring. It should be okay, but this stuff here, yeah.
That part works.
Yeah, it's,
Unless the-
okay. Alrighty. You guys cool? Anything I need to go over again? Anything you don't understand? I think we went through everything in the book. Lung sounds, we know they're going to be bubbly if they got pulmonary edema. ACE inhibitors are the prills, beta blockers are the lulls. I think you got it. If you don't, Yes, it is. 1, 2. See, I am redneck. I am so redneck. I have to think about that stuff.
You know what? That works. for me. That simplifies it to a point where my little
Yep, that's the way I have to learn.
thinking brain can latch onto it.
Yep. Yep. All right, you guys.
TPMA, go paper my ass.
Toilet paper my ass. Yep. Happy Texas. Go to school at Texas A&M. You'll learn a lot. Yep. Yep. Go to school in Texas. It's awesome. I would go back there in a heartbeat. I love it.
Advice a long time
I
ago.
love it. I would go back there.
That's just because you want to leave Wyoming. Not because.
No, because it's a family school, you guys.
Texas A&M
My
is
grandma
cool.
asked if I applied to University of Texas, and I was like, I did not want to get kicked out of the family, so
No,
no.
Texas
Yeah,
A&M.
so horn stuff. Did you guys know that that's not allowed anymore?
No
Wait,
hook 'em
what?
horns? You
Yeah.
can't do hook 'em horns
That's
anymore?
No, you
University of
can't.
Texas.
Like a lot of kids, I know at sporting events and stuff at A&M got in so much trouble. For
You can't do
doing that.
hook 'em horns. Well,
No,
that's
no,
No,
just
you can't do
rude.
horns
There's
down.
some
Yeah, you can't do
unfailings.
horns.
I know, that's was our thing.
Yeah.
was hook 'em horns.
Yeah,
Well, Lord help us.
and I'm like, what do you mean? You just-
It was Vince Young.
They've been doing this forever, and I'm
Yeah.
just like, no.
All right, is there any rhythms you guys want to go after or over, or I got them all, or you good? If you're good and your brain is on fire, you just tell me. Are we good?
I didn't even know.
I wasn't looking for it.
Are we good? Everybody good? Okay, cool. Mr. Tanner, are you gonna put this away? It goes 229, or can I? You can, because I can't get in anymore. I'm not allowed. I know the code, but I'm not supposed to be in there, so. Not allowed in there anymore. I don't work here anymore. If I go in,
Find it.
It is gonna be going that clearing minor.
you guys got my number if you need me, right?
No, I don't have your number.
1, 2, 3, 6. 1, 2, 3, 6. 259. 1, 2, 3, 6. All right. If you need anything, you just holler at me.
We're done with the class part.
Yeah.
I will stop recording out of it.
Oh, here's this. Sorry.
So I have a question.